We are here today on Healthy Living with Sarah.Ferguson. Good to see you. You've got a lot of exciting things to talk about today. I'm personally excited about, as I'm wearing my little AFib tracker here to see what's going on. We're talking about the heart today, and we're talking about a new device, at least new for the hospital, and a procedure that you're doing. Share with us a little bit about it.
So I'm the Watchman coordinator at Hilton Head Hospital. We started implanting Watchman device, which is a replacement for your blood thinner that you would take for AFib. So like you had mentioned, it doesn't treat the AFib, but for people that want to come off their blood thinner, this would be another option for them.
So is this a new procedure for Hilton Head Hospital?
It is a new for Hilton Head Hospital, but it's been around since 2015, FDA approved, and in trials since 2002.
Okay, here's the really important part for we lay people. Who's a candidate? When or how would I find out if I even meet the criteria?
Okay, so if you have AFib and you take a blood thinner and you're not tolerating that blood thinner, say you have a history of bleeding, could be major bleeding, could be minor bleeding, and you're just not tolerating that blood thinner, or if you have an active lifestyle, you like to play pickleball, you like to be out there on your bicycle, you don't want to have to be worried about the blood thinner that you're taking and a fall causing major health issues.
Is that really one of the biggest reasons that people don't really love being on a blood thinner, especially for here because we're so active?
Right, and I think it definitely puts fear in people that might be super active, and as you age, you want to be active, you want to be out there, you want to be on your bike, you want to be doing things. You don't want to have to be fearful to do those because you don't want to fall.
What's funny is we were talking about that before. I'm 68 years old and I feel really young, and playing pickleball with 78-year-olds who can outrun me. I mean, I would think that they would be really interested in something like this Watchman.
Absolutely, because like we said, it's one time for a lifetime, no more blood thinners. Most people come off their anticoagulants in 45 days, and then they would just take Plavix and aspirin for up to 6 months, and then done.
And then done. How long does the Watchman last?
For your entire life.
Oh, that's it. And then my cardiologist, who I would have if I had AFib, would monitor that.
Correct. You would be going in for your regular screens with your cardiologist. Your body actually forms a layer of skin over the device, so it's just kind of there, and it's the appendage, which is where the clot can form, is no longer.
Yeah, that's kind of what I want to talk about for a second. We've talked about a lot of people with active lifestyles might benefit from this. Can you kind of show us from a diagram where and what?
Yeah, so this left atrium is before it exits, the blood is there before it exits to the heart. So the first place it goes is straight up to the brain, which is why this left atrial appendage is the dangerous spot. More than 90% of the catastrophic strokes come from that area.
I did not realize that. Is that what, and this is a...
Yes, this is an example.
Someone gave us this.
Yes. So, you know, anatomy, everybody has a little bit different anatomy. So everybody's appendage looks a little bit different, which is why we have the different sizes.
Look at this.
This one's like just a model, you know, but this is what the actual device looks like.
Look
and
here.
That is the biggest size we have, so don't let the size scare you. But they measure the appendage, and then they decide which device fits best. We use that device, and through an outpatient procedure, 1 day only.
One day only?
Yes, not even a full day. You don't stay overnight, you go home that same day.
Okay, I am a potential candidate, and I'm talking to you, Sarah, about what I can expect and my recovery time, and I'm excited, but I'm anxious, kind of want to know what the procedure's like. How would you navigate me through all that?
So you come to the cath lab, which a lot of our heart patients have been there for one thing or another, and then you would go in. The procedure is approximately 30 minutes.
Oh, wow.
You'll be under general anesthesia because it's pertinent that you hold really still. We need you to be all the way still. So you'll be under anesthesia for about 30 minutes, a little bit recovery time afterwards with the femoral site healing, and then you go home that same day. 4 hours bed rest usually.
And then I get home. Okay, 4 hours bed rest. And then when can I resume my normal activity?
In a few days, when this heals up, you can resume normal activity. We ask that you don't lift anything heavy or
grandchildren or anything.
For a few days till that heals, and then right back at it.
And then how often am I seen by the physician in follow-up?
So in 45 days, well, that's a great question. In 45 days, you come in to have follow-up imaging so that we can see that that's been sealed off.
Got it.
And that's how you know you can come off your blood thinner.
Oh, because it's actually, the skin grows around it and
grows right over top of it, seals it off. And you know, we look for leaks. You don't want leaks around there.
Okay.
So we check all of that, and 96% of the people come off at that 45-day time.
Oh, good grief. And then moving forward, I just live my life.
You do. Follow up with your cardiologist. You know, in 6 months, after 6 months, there's no other follow-up. I just give you a phone call and say, hey, congratulations, it's 6 months. You can stop the Plavix, and all you need is a baby aspirin forever.
So what are some of the questions that potential patients ask you? Or after they've had the procedure, what are they tentative, or what are some of the things that they worry about?
I've seen really excited people. They're very happy to come off their blood thinner. Even before, you know, they want to get in there. They do their research. You know, I send you a little video, a patient brochure, so they kind of know what they're getting into. But they come excited, and when they're done, they're excited.
They're thrilled. Let me ask you a question. Okay, so we've gotten this much information. Now I'm kind of interested in doing my own research. Can I call you? May I call the hospital, the office, my cardiologist? May I go online? Can you give us some ways that we can actually practically find out more about this?
Absolutely. My email address is pretty easy. It's Sarah.Ferguson at tenethealth.com. You can send me an email. My office phone number, 843-689-8309. Or you can just call the Main Hospital. They'll transfer you to me.
681-6122.
That's right.
That's embarrassing that we know that.
Yes. Or you can just even call and ask for the cath lab, and they'll know where to find me. Or call your cardiologist. But if you need help getting in touch with your cardiologist or an appointment with them, I'm more than happy to help do that as well.
Oh, she's the best facilitator ever. Are people being proactive about this procedure?
We just started doing them, so I don't think the word is all the way out there yet, but there were people waiting on the list to have it done here.
Oh, were they really?
So yes, they didn't want to have to drive, you know, far.
And just to make sure people know, there is a physician that's going to be coming and doing these who is just kind of the expert in this.
Yes, so he's from Savannah, a doctor from Savannah that's done over 300 of these implants. He also does our ablation, so he's been here working at the hospital for years now, doing ablations, and now he's going to add this to another service that they're going to provide.
And I love talking together because we're women. Eventually, we're going to get to everything we ask. So we did your website. We did your phone number.
Correct.
And then can people go on and just research it online too?
Absolutely, yes. And you know, Boston Scientific is the company that makes it, so they even have a hotline. If you get on and start looking, that they have patients that you can talk to that have had the procedure done.
Oh, that's great.
Yeah.
And I will say that if I pitch the hospital's website, it is the most user-friendly website I have been on. So that's a great place also to find out about everything going on. You've been great to talk to, as always. And I think you make these procedures user-friendly, kind of demystify them. And I think we're pretty fortunate to have this kind of care here at our hospital. So Sarah, thank you for joining us. Stay with us. There's a lot more to come here on Healthy Living.